In this video, the summary information from the participant information sheet for MEDLEY, Methods of Early Detection of Lung Cancer in Primary Care, is read aloud. The full participant information sheet is available on the MEDLEY website, ctru.leeds.ac.uk/MEDLEY. Study Summary. Why am I being invited? We are inviting you to take part because you were referred from your GP for a chest X-ray. The reason your GP referred you was because you have symptoms that could be caused by lung cancer. What is the purpose of this study? We are looking to understand whether a low-dose CT scan should be used instead of chest X-ray to investigate symptoms of possible lung cancer. What will taking part involve? You will receive a low-dose CT scan and a chest X-ray at hospital. You will receive NHS usual standard care for anything these scans may find. Your original chest X-ray request set up by your GP will be cancelled. You will be asked to complete 2 questionnaires. We will check your medical records on 2 occasions to see how you are doing. Your care and diagnosis will not be slowed down by taking part in this study. You will be in the study for up to 12 months. Who is taking part? We are aiming for 900 people, all of whom who have been referred for a chest X-ray, to take part from a minimum of 5 hospitals across the UK. What are the risks and benefits? You will be offered a low-dose CT scan which may detect problems that don't show up on a chest X-ray. By having this scan, you will be contributing to important research that could help detect lung cancer earlier when it is more treatable. You will be exposed to slightly more radiation than standard care and may have to have some extra tests and/or treatments depending on any findings of your scans. What if I change my mind? You can stop taking part in all of this study or in any part of it at any time and without giving a reason. If you want to change your level of involvement, just let your doctor or nurse know. The standard of care you receive will not be affected. If you decide not to have either scan, you will need to arrange a chest X-ray with your GP. Chest X-ray takes a simple 2-dimensional picture of the inside of the chest. Involves standing in a special room in front of the machine while the radiographer takes the X-ray image. Takes 10 to 15 minutes. Uses radiation, about the same amount as someone would be exposed to in a few days from day-to-day background radiation. Low-dose CT. Takes a 3-dimensional picture of your chest by taking lots of individual X-ray pictures and putting them together. Involves lying flat on a table which slides through a round machine. Your head and legs will be outside the machine. Takes 10 to 15 minutes. Uses radiation, about the same amount as someone would be exposed to in about half a year from day-to-day background radiation. A low-dose CT scan exposes people to less radiation than a usual CT scan. Sometimes injections, contrast, are used for a usual CT scan. These injections are not needed for low-dose CT scans. Study timeline. 1. Invitation. You will be contacted via phone or text message by the study team and be invited to take part in the study. You will be emailed some information about the study, or if you prefer, you'll be invited to speak to a researcher in person. 2. Consent. If you decide to take part, the study team will go through the study information and consent form with you. The study team will also collect some basic information about you. They will then arrange an appointment for you to have a low-dose CT scan and a chest X-ray. 3. Low-dose CT and chest X-ray appointments. You will come in to a hospital and have your low-dose CT scan and then have a chest X-ray. Where possible, the chest X-ray will be done on the same day. At the latest, the chest X-ray will be done within 5 working days of the low-dose CT. 4. Questionnaires. You will complete a questionnaire before your low-dose CT scan and will be asked to complete another 4 months later. These can be done on paper, online, or over the phone. You may also be asked if you want to take part in an interview if you agree to be contacted about this. 5. Medical record review. The study team will review your medical records to find out about your medical diagnoses and the care you have received 4 months and 12 months after your low-dose CT scan and chest x-ray. You do not need to do anything for this. 6. End. 12 months after you've had your low-dose CT and chest x-ray, your part in the study will end. You can find out about the results on our website. To access the full participant information sheet, go to the MEDLEY website at ctru.leeds.ac.uk/MEDLEY and click on the second tab for patients.